All right, good morning. Thank you all for joining us here today, and I want to thank all of my community leaders and partners who are joining us here this morning. We are joined today, amongst the people we're joined today, we have the Mayor of the City of Rochester, lovely Warren, the Monroe County Deputy County Executive for Health and Human Services, Corinda Crosdale, the Rochester City School District Superintendent, Terry Dade, Monroe County Commissioner of Public Health, Dr. Michael Mendoza. We're also joined by Julia Tedesco, CEO of Foodlink, Bill Carpenter, the CEO of RTS, Patricia Utero, Director of the Monroe County Library System and Rochester Public Libraries, and Daisy Rivera Algarin, who will provide a summary of the information we're providing today in Spanish. Yesterday, I declared a state of emergency in response to the COVID-19, and as a result, made the decision to close public schools across Monroe County. However, we did not close schools in a vacuum. Closing schools has consequences, and there are a significant number of students and families across our community who will be impacted. And so we're here today to describe accommodations that are being made and that have been put into place, and to be able to give information and resources to families across our community about things that we've identified that we can help families begin to plan for the days and weeks ahead. We obviously do not have all of the answers to the questions people are looking for today, but we are going to continue working on our efforts and bringing people together and doing what we do best, which is pulling people together, leaders together from across our community to come up with answers and solutions and be able to get all of the information out to the public and to our families across this community as quickly and as accurately as we can. The group of individuals I'm standing here with today are working tirelessly around the clock to put systems in place and to collaborate so that we can serve and better protect and keep the public in Monroe County healthy and safe. Today, specifically, we're going to hear from Deputy County Executive for Health and Human Services, Corinda Crosdale, who will provide information related to available social service benefits that are provided by Monroe County, including information about daycare, daycare subsidies, and SNAP benefits. Mayor Warren, Superintendent Dade, and Julia Tedesco will speak to the accommodations and plans that are being put in place to support our city school district students and families as it relates to food access and other citywide services. And I also would like to put a note out for our suburban families who are watching us from home that they should also be looking for information related to school-provided meals, specifically in your communities, from your local school districts. All of our school districts are working incredibly closely with Foodlink, and they're working collaboratively with each other. And you should check directly in with your school district and superintendent for more information. And we'll obviously be looking to link that information through our website as well. Finally, we will also hear from Dr. Michael Mendoza, who can provide a public health update to our community. So before I hand this off, I want to reiterate something that I said yesterday. There is a lot of understandable anxiety in our community right now, which is exactly why it's important now more than ever for us to come together and to help each other. Look out for your family, make sure they're practicing healthy hygiene, social distancing, and calling the doctor if you feel sick. But if you have a friend or a neighbor who is vulnerable, it is important that we check in on them too. At some point in the coming days, it is likely that the number of tests in our area and areas across the state and the country are going to go up. We've seen that. We've seen that in the news over the last several days and over the last several weeks. And we've seen it internationally in places where COVID-19 has emerged. I want the community to know that my administration, including Dr. Mendoza's team at the Public Health Department, the mayor's team at City Hall, all of our school district leadership, law enforcement, emergency responders, our two incredible, talented hospital systems, and so many of our community organizations, town supervisors, public officials, and leaders throughout the nonprofit and community-based organization community are working together to serve residents across Monroe County, and we're bringing people together to put systems in place to make sure that families have the information they need to keep their families families healthy, safe, and protected, and that we're making changes to the system to get that information out as soon as possible, and that we can also be flexible so that as the days and weeks go on and the changes and needs of this community change, that we're ready and prepared to be able to offer this, to continue offering those services and make sure that we're doing all the right things, again, like I said, to keep people healthy. We are all in this together as a community from every corner of Monroe County, New York State, the country, and the world. And we're going to get through this together because we're going to work together, we're going to help each other, and we're going to do what Monroe County does best. I have been delighted to see over the last several weeks people around this community asking, how can we help our neighbors? How can we help vulnerable people in this community? I've seen parents, I've seen families in Wegmans. I've been in the grocery store myself, and I know there's anxiety and people are stocking up on supplies at home. But just as importantly as making sure you have the supplies in your home for your family to keep your family healthy, if you have vulnerable neighbors, if there are vulnerable people that you know in your community that don't have that same ability or opportunity to stock up on those supplies themselves, we need to check in on them. We need to call them. We need to ask, how can we help you? How can I share resources that we have, that I have, and help you have the resources you need so that you can stay home and stay away from large social gatherings? That's what this is about. The vast majority of people in this community are going to be fine. This is about keeping COVID-19 and the virus away from the most vulnerable people in our community, and each and every one of us can step up and play a role in making sure that we're helping those vulnerable people so that they can stay out of harm's way, but make sure they have the resources they need in place so that they can do that. That's the responsibility of this government, but that's what I'm going to challenge the residents of this community to do, is to stand up, find out how we can help the most vulnerable in our community be able to get through this, because we will get through this together as a community. I also want to be able to point out we're putting resources on our website. www.monroecounty.gov has plenty of information and resources. It's updated regularly, so if you're looking for information, please go there. And then I also would like to remind the public that Monroe County has opened a hotline. It's 585-753-5555, and that is our local public health COVID-19 hotline. So next I'd like to bring up to the podium someone we've been working very closely with, my partner in government, we've been talking constantly about how we're protecting and keeping safe the people in the city of Rochester, the Mayor of Rochester, Lovely Warren.
Thank you, County Executive Bello. I just want to commend the County Executive for his leadership during this crisis that we find ourselves in. I can tell you that he and his team have been not only providing the leadership that we need at this point in time, but have been coordinating and working with all of our community partners to make sure that the information that we get is up to date, that it's relevant, and making sure that we are all working together to provide the best quality of services to the residents of our community. So I want to again thank the County Executive for his leadership and for all that he's doing to make sure that we are not only prepared for this COVID-19 situation, but also working in partnership with all of us. Yesterday, he made a very tough decision to declare a state of emergency here in Monroe County, which of course resulted in a number of our schools being closed. The number of calls that I know that he received, as well as our team have received from parents and residents that were concerned about how their children are going to get food, how they are going to get to daycare and other services. We want you to know that that was not a decision that was done in a vacuum. It was a decision that was done with the support of many leaders in our community, but also understanding that we all would have to step up to the plate and work together in order to make sure that our children and families are taken care of. And that's why today we are here to announce, along with Foodlink and the Rochester City School District, that the Rochester Art Centers will be open tomorrow from 8 a.m. to 8 p.m. to provide food distribution to children and families in our community, along with some 7 school sites that the superintendent will talk about. The 9 centers that will be open in the city of Rochester will be Avenue D, Adams Street, Carter Street, Gant, Douglas, Flint, the Tyshawn Caldwell Center, the Trent and Pamela Jackson Center, and the Ryan R. Center, along with 7 school sites that the superintendent will talk about. There will be a total of 16 locations located throughout the city of Rochester that will be providing food to children and families from our center sites from 8 a.m. to 8 p.m. on tomorrow will be open. We also will be having our libraries operate on regular hours, because we recognize that in order for families to be able to access some of the services that the Deputy County Executive will outline in a minute, they will need to have access to fax machines, emails, and also computer systems. So our libraries will remain open in the city of Rochester on regular office hours and operating hours. This week we will reassess as we go forward, and if things change based on what Dr. Mendoza as well as the County Executive outlines for us. Again, we recognize that these are challenging times for our community. We recognize that a number of people are afraid of what's yet to come. But I can assure this community that under the leadership of the County Executive, Dr. Mendoza, working in partnership with all of our city officials, City Council, and all of our community partners, that we're working collaboratively and collectively to make sure that the public is taken care of here. We understand that many families are afraid of what's next to come, but I think, as has been outlined by the County Executive, if you know someone that is in need, check on them. If you have some support and resources that you're able to give to them, provide it to them. In this situation here, we all have to take care and be our brothers and sisters' keeper. We have to work collectively together to get through this. The support has been outlined, and that is the reason why we recognize that schools closed. We do not want to leave our children without options for access to food, and so our centers will be taking that on. Our Commissioner of Youth and Family Services is here, and she will, and her team are ready and equipped, but all 14 our centers will not be open tomorrow. Only our 9 centers that I outlined will be open tomorrow to provide food to our residents from 8 a.m. to 8 p.m. And we're asking you, if you have any questions on that, to please call 311 or visit www.cityofrochester.gov, and we will be putting that information out. We want to make sure that we are providing the support that our children and families need, and I think that the superintendent, when he comes up, will talk about the 7 sites that will be located in our schools and the times that they will be open, and the Deputy County Executive will give some more information on how children and families can access other services that the county has available. I want to thank all of our government partners that are here with us today. I truly, truly want to thank City Council Member Mitch Gruber, as well as the CEO and President of Foodlink, Julia Tedesco, because without Foodlink and their ability to really step up and provide services to our community during this time of need, we wouldn't know where we would be as it pertains to food in the afternoon and in the evenings for our families. So I really want to thank them, because weeks ago they were preparing for this, and they have been ready and willing to step into the gap to make sure that our children and our families get the food that they need. So please recognize and understand that working together, we are going to provide the opportunities and the support that our families need to our community. Again, thank you to the County Executive, and I would like to turn this over to the Superintendent to talk a little bit more about the school sites that will be open.
Good morning. Thank you all for being here for this important update. As Mayor Warren and County Exec Mr. Bello stated, this is a true example of what collaboration looks like to make sure our students, our community, are all getting what they need during this time of great uncertainty. So while we officially closed yesterday, we have been preparing for this moment for a while. So I wanted to lean in on some of the details with regards to the school sites that will be providing meals for our students beginning Monday at 8 a.m. until 2:30 p.m. Beginning this Monday. Those sites will be Wilson Foundation, Monroe, East, Freddie Thomas Campus, Jefferson, School 5, and School 42. So at each of these sites, breakfast and lunch will be provided from 8 until 2:30. Dinner will also be provided with our great partnership with Foodlink, who are greatly commendable in this time of need. I also want to make sure that everyone, our students and our parents, know that we're also developing plans to make sure that our students are provided resources to continue their learning during this time of school closure. So look for additional details from me and my team later today. They'll be sent directly to our parents and our community members of how they can access ongoing learning resources and materials. Our plan to make sure that our adults in our system are stepping up in this great time of need to support our students and do right by them. So look for additional information. We're working closely with our collective bargaining units to make sure that we're keeping our schools and our staff members safe, but also keeping the main thing, and that is our students in the RCSD. So we will be providing further details by this afternoon with regards to those impacts. The other piece I want to make sure that our community knows is that there will be numbers established to make sure that our mental health needs are being taken care of while schools are closed. So in the additional information and updates, you'll get links to various websites and resources, in addition to hotline numbers that will be manned at least 8 o'clock a.m. to 5 o'clock p.m. each and every day, so we can connect you directly to those mental health services that we do not want to be adversely impacted during this closure. So I want to reiterate just my admiration for Mayor Warren, County Exec Mr. Bello, and her teams, because none of these decisions are being made in isolation. It is a daily communication between all sorts of organizations, in addition to Dr. Mendoza and his team, leading us with the science and the health impacts behind all of our decisions and the mitigating circumstances that could occur based on our decisions. I also want to thank our school personnel who are going to be serving on the front line to make sure that our buildings are disinfected to the appropriate measure. So we are ready to open our buildings and ready to rock and roll as soon as County Exec and Dr. Mendoza lead us down that path. So thank you to our custodians, our food service personnel, all of the folks who are sacrificing, leaving family members at home to make sure our students are getting what they need during these truly uncharted territory. So thank you for your ongoing support. Thank you, Mayor Warren and Mr. Bello, for your ongoing steadfast leadership. And right now I'm going to turn it over to Deputy County Exec, Corinda Khan.
Good morning. Under Governor Cuomo's Executive Order 202.1, every effort is being made to reduce social contact. The executive order impacts the delivery of public benefits through the suspension of 3 provisions of social service law, which eliminates the requirement for face-to-face interviews. This applies to all residents in Monroe County seeking assistance for public benefits and emergency services. Beginning on March 11th, the suspension of face-to-face interviews will be in effect for 30 days for all new applicants and 60 days for current beneficiaries. With schools closing, many parents are scrambling to find alternative child care. For those parents who can't afford daycare and who qualify for child care eligibility, will qualify for child care eligibility certificates. This will allow for the use of subsidies to pay for child care by eligible providers during school closures. The daycare application will be available online at our COVID-19 information page by noon today. The page can be found by going to www.monroecounty.gov. Anyone applying may email or fax back the child care application. In addition, any parents whose children are receiving before and after school care will have access to full day daycare. We also have resources for all families in need of daycare, whether or not you receive a subsidy from the county. The governor's executive order has suspended requirements related to capacity and staff ratios, which will allow some daycare providers to increase the number of children they care for. As daycares close or increase slots, the most up-to-date information will be available with the Child Care Council, and that can be found at www.childcarecouncil.com, or you can call the Child Care Council at 585-654-4720. If you're having difficulty purchasing food and are eligible for reduced lunch, we encourage you to apply for SNAP benefits online. If you already receive SNAP benefits, please contact your worker for assistance. We can supply additional SNAP benefits as needed. Our goal is to ensure the basic needs of our community are being met during this critical time. Information on how to access these benefits and to answer any of your questions on how to obtain benefits under these new rules are available online at our website, which will be continually updated as things change. So I'd like to now turn it over to Foodlink for more information.
Good morning. My name is Julia Tedesco. I'm the CEO and president of Foodlink, the regional food bank. Foodlink is as prepared as possible to continue to feed this community, particularly our most vulnerable citizens during this time. And I want to thank county and city officials for partnering with us to make this possible. I also want to acknowledge in a special way Foodlink's Chief Operating Officer, Keller, who's been working around the clock over the past several weeks, not just days, to ensure that we are prepared to meet the need. As you've already heard, Foodlink will be working with the city and RCSD to make sure that meals will still be accessible to school-aged children during this time. Foodlink alone expects to serve more than 20,000 additional meals this week, using every safety precaution possible in the preparation and delivery of food. As you've already heard, the rec centers that Mayor Warren referenced will be open from 8 a.m. to 8 p.m. The school sites will be open from 8 a.m. to 2:30, and we are encouraging a grab-and-go option. These will not be sit-down communal meals. They will be grab-and-go, and we'll be encouraging students to take advantage of that as much as possible. We know that we've been in touch with charter schools and other districts across the county. We know that they are also preparing to have similar meal options for their students, and we will continue to be a resource to those schools, but we do encourage families with children to first and foremost contact their local school district to understand meal options during this time. Separate from these meals for school-aged children, Foodlink will be expanding our emergency food service in the coming days and weeks. We anticipate distributing more than 2 million pounds in the next few weeks alone through our network of emergency food agencies, including pantries and shelters. Our message to food pantries throughout Monroe County is this: your services are needed. We encourage pantries and other agencies who have the capacity to stay open to do so, to stock your shelves by accessing resources at Foodlink, and to continue to serve our communities. We encourage you to modify your distribution methods as needed to ensure the safety of your staff and clients, even if this means moving to an appointment-only service model. Foodlink will continue to make as much food as possible available to these agencies and to serve as a resource in helping you keep your doors open. Information regarding agencies at the neighborhood level, pantries that are available to serve emergency food to community members, will be updated on 211. We encourage families to go to 211 for that information, and foodlinkny.org. Foodlink will also be partnering with the City of Rochester and others to hold emergency food distributions for low-income households during this uncertain time. When scheduled, we will make that information available again through 211 or our website, foodlinkny.org. So to recap, I just want to reinforce that there are 3 avenues that we are coming together to increase access for families in need. First, school meals will continue to be made available through rec centers and school sites, as you've already heard. Second, there'll be an expansion of SNAP benefits, as Corinda Crossdale just outlined, and the county will be responsible for ensuring you have the information on that. And third, Foodlink will ensure increased access to emergency food. Finally, there has been an onslaught of goodwill in response to this emerging need. For public health reasons, Foodlink is not hosting large groups of volunteers. The best way to assist is by supporting our efforts financially, which you can do by visiting foodlinkny.org. We are also in particular need of cased product, and we urge food manufacturers and distributors to contact us if they are in the position to donate. United Way of Greater Rochester has taken the lead in serving as a central hub of communication for nonprofit, community-based organizations who are hard at work serving this community during this time. Early this coming week, thanks to United Way, there will be a centralized place online for volunteers to go to support a wide range of nonprofit and response needs. More details will be available in the coming days. Visit foodlinkny.org or uwrochester.org if you are in a position to help. Again, more information will be added in the coming days to these sites. Thank you.
Buenos días, mi nombre es Daisy Rivera Algarín y estoy aquí para darle en español a nuestra comunidad que habla español lo siguiente. En este día la alcaldesa Warren, el señor Adam Bello, ejecutivo del condado de Monroe, el superintendente del distrito escolar, el señor Terry Dade, y el doctor Mendoza, estamos todos juntos para añadirle a ustedes lo que se ha dicho en inglés. Lo siguiente, el distrito escolar con la ciudad de Rochester, nuestros centros de recreación, van a estar abiertos para proveer comidas a los niños. Esta es la comida que se les da a los niños durante el día en la escuela, pero también se le va a añadir el desayuno y una cena por la tarde. El distrito escolar con el centro de recreación va a estar abierto para nosotros durante las 8 de la mañana hasta las 8 de la noche. Pueden ir a los siguientes centros. El Adams Street, locado en el 85 de la Adams Street, Avenue D, Carter Street, Taishuan Caldwell on Campbell Street, Frederick Douglass on South Avenue, Flint Street, en la 271 de la Flint Street, el David Gatt, 700 North Street, Trenton and Pamela Jackson en la Clinton, 485 de la Clinton Norte, y el centro Thomas Ryan, el 530 del Webster Avenue. Los siguientes centros de recreación se han escogido por el tamaño y por el lugar donde están localizados. También le queremos compartir con ustedes que la comida estará disponible en los centros de recreación, pero también tenemos los siguientes lugares, los siguientes recursos, perdón. Si usted recibe servicio de SNAP, puede llamar al condado de Monroe para ayuda en recibir más recursos. Si usted necesita comida de emergencia, estén pendientes porque nos vamos a reunir para proveer información acerca de donde ustedes pueden recibir comida de emergencia. Eso es todo para ahora. Gracias.
Good morning again, and thank you for the opportunity to provide you a brief update on the work that's happening currently in the health department. First of all, I want to amplify a few messages from yesterday, first pertaining to social distancing. As you've seen, the schools have taken the bold step of closing. I want to encourage other schools, private schools, charter schools, and others to strongly consider closing down as well. Please have conversations with your parents, your families, to undertake this also very bold step in a measured and thoughtful manner. Daycare settings, obviously a very important resource in our community, and we also know that they can represent a risk for transmission of this illness. And so I also want daycare centers to reevaluate their operations, be in constant communication with your families, and evaluate the extent to which you will might be able to close completely or at least modify your operations in a way to mitigate any available risk. I want to call out senior centers, places where our older adults will go for recreation and other purposes. I understand that these are vital services, and we also know that these locations can represent a risk, particularly for our most vulnerable residents. And on the topic of all other non-essential gatherings, I understand also that we are a social being and that we like to be around one another. And at the same time, we also know that restaurants and bars can represent a risk. And so I am asking for your cooperation to evaluate whether you can close down as a restaurant or a bar. Again, at this time, I'm asking for your cooperation to evaluate whether you can close down if you're a restaurant or a bar. Finally, I want to emphasize the point that Superintendent Dade made earlier about mental health. Later on today, we'll be posting information on our website that speaks to the importance of mental health, particularly for those who are under quarantine or isolation. Our mental health is valuable and critical, especially during a time like this, and so we want people to be thinking proactively about the things that we can do to help mitigate any of the threats to our own mental health. On the issue of hygiene, we've spoken about this almost to the point that you are all going to know what I'm about to say. I want to emphasize the importance of hygiene and social distancing, especially among healthcare providers, including staff, administrators, all who go through the door in a healthcare facility or a nursing home. Visitors to these settings, you've already heard of restrictions occurring for visitation at hospitals and other settings. Even if you are visiting, please do everything you can to observe proper hand hygiene, avoiding coughing into air. Please cough into your sleeve, and absolutely do not visit these sites if you are ill. Finally, I want to speak a few words about testing. We've received a lot of calls about testing for the novel coronavirus. Currently, according to the New York State Department of Health, we want to prioritize those for whom testing will make the most impact on this epidemic. And that includes, number one, individuals with close contact with a confirmed COVID-19 case. Number two, people who have traveled from affected areas and who have symptoms. That's travel and symptoms. Number three, if you are currently in isolation or quarantine and you develop symptoms, we should be aware of this because we are monitoring the people in isolation or quarantine, but again, that is the risk factor if you're in isolation and quarantine if you have symptoms. Number four, those who have respiratory symptoms, particularly fever, cough, and shortness of breath, who have otherwise tested negative for other viral etiologies. That would be the fourth criteria. And then the fifth would be at the discretion of your clinician or healthcare provider. Now, to speak a few words on that, we are not recommending screening for asymptomatic people, but we will consider it, especially if you are in a high-risk profession or work in a high-risk setting. We are working to broaden the criteria for testing. At this time, we are expanding capacity. You've heard that Rochester Regional will now be able to provide novel coronavirus testing for their patients at this time. And I also know that the University of Rochester Medical Center is forthcoming with an announcement in the near future on that as well. Finally, I want to say a few words to update you on the issue of the individuals that we have yet to contact from the Greyhound bus, from our first individual. I want to emphasize that the people at most risk are the people who came to Rochester on Wednesday morning on bus number 252. We've gotten a number of calls from many people who have taken a Greyhound bus in the last 4 days. We want to prioritize those individuals who were on the bus with our first individual on that morning. All the other Greyhound buses, however, are safe as we know it today. And finally, an update on the Greece situation. A lot of questions about what members of the Arcadia Middle School community ought to do. We have contacted all of the people who we believe to be at high risk, and we've provided instructions and/or testing for those individuals as appropriate. All other members of that community should monitor their symptoms for fever, cough, shortness of breath, and contact us, and that applies beginning now until March 20th, Friday, March 20th. Thank you.
Thank you, Dr. Mendoza. And I know there was a lot of information to hand out today, so we have some time. We could take some questions for any of the folks here who have details about any programs you have questions about.
Under the guidance of the health department, and of course, we're going to do everything that we can on our side to sanitize and make sure that our centers are sanitized daily, and we're, with the governor's help, going to have hand sanitizers available as soon as our young people walk in the door to be able to sanitize their hands, grab the food. We will also be providing our staff with details on how to keep themselves safe, as well as gloves and other things that they will need in order to get the food to our children as safe as possible. I know that the superintendent and his team, of course, in the schools will be sanitizing as well. At this point in time, we have to make sure that our children get the nutrition that they need. And that is a priority, and that's why we're going from 14 sites down to 9. We're making sure that we give all of our staff the information that they need that will be working at these sites to make sure that they're safe, and when they're distributing food, the children are safe as well. But that will all be in partnership with, of course, the Department of Health as well as the county execs and the governor's office.
Is there a plan for transportation for the children who need it to get to these sites?
All of the locations in the city of Rochester, and that's why we have so many sites that will open up, will be in neighborhoods so children and families can walk there. There is a discussion with RGRTA as well as the county around bus transportation as well. But at this point in time, the reason why we opened up the sites in the locations that we opened them up was so that they can be in neighborhoods where people can actually walk there, grab the food, and return home.
So we're following this closely across the nation. So we're not the first district to close down. There's been large districts from the West Coast all the way to the East Coast that have already tried to tackle this very important question. And it becomes a question of equity and access. Every single student in RCSD does not have access to Wi-Fi at home, nor do they have the devices in their homes at this point. So our responsibility is to really think about what kind of resources and materials can we provide that's going to serve as continuity of learning. But at this time, there's no system that has been able to come up with a plan that's going to be able to have every student on a device continuing their learning in a system as large as the RCSD, particularly an urban district like ours. So more details will be forthcoming this afternoon. It'll go out to our entire community as a starting point. Mayor Warren did a great job this morning of reminding us that this is phase 1 of many, many conversations that are going to occur. So these plans are going to evolve over time depending on the duration of our closure.
Questions?
Well, mental health is so critical, particularly during a time like this when there is so much anxiety and uncertainty. Without a doubt, we're going to have to rethink how we support one another from a mental health standpoint in a way that does not involve large gatherings. So smaller gatherings, one-on-one conversations, and our technology. If there's one thing that our kids know well, it's technology. Let's use that technology in perhaps a different way to allow us to remain connected with one another in a way that's safe. And certainly very important, if you are having or feeling anxiety or feelings that you're unable to manage on your own, I want to encourage you to reach out to your healthcare provider earlier rather than waiting at home and suffering in silence.
Are there any additional confirmed cases, or have
We have a number of tests that we have sent out last night. Those results are still pending. We currently only have 2 confirmed cases.
Can you tell us how many tests went out?
I don't have that number right now.
Regarding the RCSD tests, how many people did you guys identify?
I'm sorry, I don't have the number of tests that we sent out on them, at least 6 that I'm aware of.
Do you feel like parents would have to get tested or students were exposed? Do you feel as far as that?
It would depend on their risk. We have contacted all of the people that we believe to be most at risk. A student that does not have symptoms does not need to be tested. They simply need to stay home and monitor their symptoms. And I would encourage all family members of students also, out of an abundance of caution, to manage their, to follow their symptoms as well. But they would not qualify for testing at this time.
Do you envision parking lot testing? The president has announced this over the weekend, yesterday, Friday, that Walmart and CVS and some of these locations will be set up around the country to do testing and drive-up capacity. Do you envision that happening?
That is something we are currently evaluating.
Do you guys have an update on patient 1 and why weren't we told he was on the bus at the first conference?
Patient number 1 is currently under isolation and doing well. When we learned of that situation, was it Tuesday night, we did not have a confirmation of all the details yet at that time. We hadn't even had the bus manifest to confirm that he was on the bus. And so we wanted to make sure we had accurate information before disclosing anything to the public.
The family members of patient number 2, have they been tested? Are they currently in quarantine? What is life looking like for them right now?
So we have evaluated that family, and it is a relatively large family. We have put a number of them under isolation, and we've quarantined a number of others as well.
Have any been tested?
Yes.
When it comes to daycare, I know at one point there's an application for parents if they need daycare, and you're saying it might be a risk. So how does that work?
Well, daycare is obviously very important, and we want to be very thoughtful about how we approach daycare. And at the same time, we know that large groups of kids can represent a risk both to the kids and, frankly, to their family and older adults in that family. So at this point, we want to encourage all daycare centers to evaluate this, and we are hoping for their cooperation.
This one would be for either the mayor or the county executive. Is there anything being done to help the homeless population in this kind of crisis?
Sure. We just had those conversations as well about New York City has made available hand sanitizer that we're going to be taking a look at to get out there to the homeless shelters and to be able to make sure that they're as safe and protected as well. So we're working on that right now. Or did you have something you want to add?
And Julia, of course, Foodlink will continue to provide food to the homeless shelters as well.
Will the RCSD also use as a
At this point in time, we are encouraging grab and go. So that's what the direction that we have received. So we will be sites where they can come grab their food from breakfast, lunch, and dinner, and return home. And in partnership, as the superintendent indicated and the county executive has outlined, this, constantly we're evaluating what we're doing and if this is the best way to take care of our children and families. At this point in time, we want to make sure that they have nutrition first. That's the first thing that we're dealing with. Then we're going to be talking with the superintendent and his team about the educational component of it to make sure that they still have access to what they need as it pertains to their education. But we wanted to make sure that people know on Monday there will be places where they can go, grab their food, have some nutrition, and then go home. And it's through the great partnerships that we have in this community that we're able to provide those services to families. But we will constantly be updating you along the way about what other resources will be available to our children and families.
Is there concern that maybe some our centers might be more people
So again, we are prepared to deal with as many people come to our center. The reason why we have as many sites open between the 9 our center sites as well as the 7 city school district sites that will be providing food will be because we want to be able to spread people around based on the direction of the medical director, Michael Mendoza. So right now, that's why we're encouraging grab food and go. But we will evaluate if we need to be bringing more food to another location as we go along. We'll see what happens tomorrow, how many people show up for breakfast, how many people show up for lunch, how many show up for dinner, and we will constantly assess that, of course, with our partners. And I know that Foodlink has really been prepared in working with food distributors throughout the city as well as the state to make sure that we have enough food available for people.
Will you guys be doing that in practice, social?
Yes, we will be putting in, we're not going to, the thing that we're not going to do is have kids stand outside in the cold to get food, and so we are going to bring them through in a concerted effort to make sure that we're complying with the regulations that have been outlined, but that they're getting the nutrition that they need in order to be safe as well. Right now, dealing with making sure that our children and our families have access to food is our #1 goal during this time, and then we'll assess going forward based on what we know Monday and Tuesday. On Wednesday, the county executive is bringing us all back together to talk about how is it working, do we have more sites that need food, and is there additional resources that we need in those locations in order to make sure that those children and families are taken care of.
This one would be the county executive. Sure. We've been a lot of talk of social distancing right now. This morning, Governor Cuomo sent out a tweet saying, "Decision each of us makes now will impact us tomorrow. Stay home." Dr. Mendoza recommending local bars and restaurants close up shop if they can. Is this something there's not a lot of reassurance in any of those messages that things are okay right now?
Well, as we described yesterday, we announced yesterday morning the first case of what we believe to be a community spread, where how this patient contracted the virus is unknown to us at this point. And we've been very clear over the last several days that people should start implementing reasonable social distancing practices, as well as practical hygiene practices as well. When it comes to washing your hands, make sure you're coughing your arm and sleeve. But also, over the last several days, we've been announcing a number of steps that people should take when it comes to respecting the limits that are putting on capacity sizes of rooms, staying away from large social gatherings, and again, that's why we took the extraordinary step yesterday, working collaboratively with the schools to close the schools as well throughout Monroe County, because we really do need to reduce large gatherings and again start practicing social distancing to keep people away from each other when we can and can do so safely, because that's how we're going to cut down on the spread of this virus. And so those are the recommendations that we're giving. I ask people at home to please heed the recommendations of our health professionals, particularly Dr. Mendoza, who's been doing a fantastic job, him and his team, getting this information out there. And that's also why I keep saying, again, as a community, we need to be looking out for those who are the most vulnerable, right? Because what we don't want, particularly as we're taking care of our families, stocking up on food and things like that so that we can stay home, because that's why people are stocking up on supplies, so that they can stay in their homes and not have to be out in the community, not have to go out to bars and restaurants and things like that. We also then need to call our neighbor who doesn't have that same opportunity to go to the grocery store and stock up as well, and make sure they have the supplies that they need to stock up so they can stay home too. Okay? So that is the message that we're giving out. Yeah. Oh, and you can.
Can I just add one thing, because it touches on the last question as well. Every single opportunity here is an educational opportunity. So there's a reason why typically what Foodlink does was we do communal meals. We've changed that to grab and go specifically so that we can talk about and help and use our center staff to help practice social distancing. Typically our food pantries do things like client choice, where individuals go and shop and touch each thing. We are now doing pre-boxed packages for each and every one of our pantries. So in each and every one of these opportunities to provide food, educational opportunities are built in and baked into it as well to talk about social distancing and take best practices from Dr. Mendoza.
Okay, so
One question.
And for people in professions that cancel the business, police, fire, do they have what they need to do the job every day?
Yes, we're actually talking to, of course, our police chief, our fire chief, and we have stopped, gathering in the morning before shifts and gathering in the afternoon before they go out on roll call. All of that information is being provided for them in the car. Our firefighters have been instructed that when they get a call to certain houses to go in, and instead of 4 people going in at one time, 1 person go in, 1 or 2 people go in and assess. And so we are, as a city, planning in our operations in every department to operate social distancing. We are talking about having people work from home that can work from home so they're not in the buildings. We are talking about individuals doing Monday, Tuesday, Wednesday, Thursday sort of shifts. And so I think that as we prepare for this and as certain information comes down either from the governor or the county exec and Dr. Mendoza, we are prepared to operationalize those in our departments. But each of our chiefs are being talked to daily, and they're relaying information to their staff in mitigating those types of contacts. One of the things that we are talking about now is report taking, and not necessarily having police officers having to do that, but actually having people call in to 311 to be able to have people take those reports over the phone if need be. And so across the board, I think that we are in some interesting times right now, and we are preparing our staff to be able to deal with it most effectively and efficiently based on what's being given to us from the state as well as our local Department of Health.
So before likelihood that there are hundreds, if not thousands, of unconfirmed cases right now in the county, and we just don't know because there aren't the tests to provide that data yet.
That's the number one question that we're entertaining as a nation. That has been something that has been posed. That is something certainly on the minds of health professionals. Right now, we don't know what we don't measure.
Okay, so we're gonna wrap up. Before we wrap up, I have one more message I just want to deliver here. So a lot of information was given out today related to services that are being made available to families in this community, particularly as it relates to school closures. So I want to reiterate to the media who's here today, and again to people who are at home, access to that information regarding daycare, particularly for low-income families who need access to daycare subsidies. Families who are anxious about trying to locate daycare, where are those available slots through the Daycare Council, changes being made to the SNAP program to provide additional food benefits and access to food, access to rec centers, food distribution centers in the city, and also to the suburbs. There's a lot of information given out. We will have all that information linked and posted on our website at monroecounty.gov. So as people have questions about their individual daycare needs, if they have questions about subsidy programs and financial assistance programs, please get that information out there to go to our website at monroecounty.gov. I'd also like to remind you, this is a changing situation every day. We are working together as a community. All these folks behind me and the people that I've been bringing together and we've been bringing together every day to push out information into the community is working very hard to make sure that we're linking the right community resources, the nonprofit communities, the community-based organizations, the governments that are around this community to be working on these issues and get the information out. So it's important that if all the news here can continuously to link to those places of information online, that would be very helpful. So thank you all very again for today. Appreciate it. Thank you all.